calling it. That's cute. So we'll be carrying that live stream at 9 o'clock. Also, Sergeant Paul Tapau coming on the show in a bit. Let's do the Minority Report now with Senator Chris Duenas, the Minority Leader at the Guam Legislature. Senator, I kind of wanted to start with this Healthcare Center of Excellence bill that was unanimously passed at the legislature. And I know there was a lot of discussion, not just in the legislature, but also with the congressional office about how this project was, way off, and why do we need to, lockbox his money to build it today when it's not going to be built for several years off. But I kind of understood that, the political look of it is if you voted against something, a bill that would build a new hospital on it, I mean, they're just going to drag you through the mud. So it passed unanimously, but does that mean you didn't have any concerns with it, Senator?
Actually, no, Chris, and thanks. And good morning, Chris.
Good morning,
and Jason.
good morning.
And I understand Bree's on her way in.
Yeah.
No, actually, this bill went back to committee twice. And so I believe the introduction was sometime maybe around March or April. So there was concerns initially when the bill was first introduced. The concept was really understandable. I mean, the fact is that we need a new hospital. I don't think anybody disputes that. The issue of public health and the Guam behavioral is something that, we wanted to understand more of what was the reason behind this thought of a medical campus. And so this bill actually has turned out to be something quite different now as passed unanimously than what it first came out. Chris, what this really is, and what a lot of us wanted in working with the chairman, Joseph Augustine, what we wanted to see is a financing bill. We wanted to see something that basically reflected the priorities of the legislature, saying that this one opportunity of a lifetime, none of us ever thought we would ever achieve getting the reimbursement of EITC from the federal government. And so when that $55 million, kind of like was passed in Congress, that we would now be getting reimbursed for EITC, a lot of us thought, okay, let's roll up our sleeves and concentrate on the priorities of our government, right? And so this bill now really is a financing bill. It's an earmark of $35 million of the reimbursement of EITC for primarily, first and foremost, a hospital. We were able to pass an amendment. Good morning, Bree. We were able to pass an amendment in this bill that basically prioritizes the hospital. If you look at a lot of the other amendments, it basically kind of made sure that this bill essentially just put the 35 million there, and some of the other considerations in the bill were taken out. And in the final version of what was voted on, it is a very strong financing mechanism approved by bond council. And I think that's why the senators in the end were very comfortable with this bill going forward.
I did want to ask, I just walked in, but I wanted to follow up on something that was said during the Rotary Club meeting, and whether or not the legislature was aware about the land that the military was going to be transferring the land at Eagles Field
right
to the governor in December. Was that something you guys were aware of?
And so that's also kind of, if you watch I think there was a total of 3 committee of the whole meetings, and including the public hearing for the bill. And so a lot of the questions really did center around, why are we doing this now when we don't see that the plan itself is complete and solid. And so a lot of that had to do with the issue of the property. Where are we going to build this medical campus? Now, basically what has happened is Lillian and her team in the hospital has consistently said that they need a footprint of property that's going to be large enough for this campus, because at least particularly for Guam Behavioral and the hospital, like now, they are co-located. And the reason why is because you do have a lot of overlapping individuals that are getting treated for substance abuse and other issues may require hospitalization and access to a hospital from time to time.
Yeah.
So it does make sense to co-locate, right? And you're right. What we were grappling with, and we continue to grapple with, is like there's this issue of the military having to get into a lease agreement with the government of Guam in order to, provide that footprint of property at Eagles Field. Now, according to GITA, they said that that offer should be prepared by next month, October, or actually, excuse me, now it's October. We were discussing this during the September session. So in a few weeks, maybe we're going to get an announcement that the military has entered into an agreement or made an offer to the government of Guam to lease that property. One of the things I remember us talking about early on, Bree, when we were talking about this concept was, there are going to be perhaps issues with original landowners. The way that the way property issues exist right now in terms of transfer from the military back to the government is original landowners. This seems to be a workaround, if you will, if it's going to be leased. But landowners still, I've gotten calls in my office and I've talked to individuals, and I've actually heard in different forums that original landowners aren't happy with that they believe that if there's going to be lease proceeds to the government, it should go to them. And so, it shouldn't go to, why would we be leasing from the federal government, and not paying the original landowners? Yeah. So that is possibly going to be a sticking point. So that's what, as we were discussing this, we kind of pushed aside all that and said, look, are we committed to making sure that we're going to set aside funding for a hospital with this reimbursement for EITC? That consensus came together, and so that's what this bill is. All the other issues that have to get worked out are going to have to be worked out, but I still believe that Manguilao property is contentious at this point. There's many of us that believe that perhaps the old hospital location actually should be the location. And so that's going to be up for debate. But as far as the bill, if it gets signed into law right now, it's strictly a financing mechanism.
Okay. Yeah, I was confused by the whole thing. But let's go to that original landowners. Has there been any comment at all from the administration about what's going to happen with this land? Do we even know who the original landowners are?
I consistently have asked that in the roundtables and also the different meetings that we've had. There's been several updates from the hospital, just on their general operations, but it always comes down to the task force that's currently working on this hospital, construction and the plan. And we just never get an answer. And I think it's something that deserves an answer, because I've asked several times if they have approached and worked with Ancestral Lands Commission to make sure that, they can settle this issue. Now, the consistent, I guess, retort or feedback that I get is we're leasing from, the federal government, and that's not a concern. I don't think so. And I don't know why you wouldn't do that, right, Chris, at the front end. Just go and settle that issue. There's surveys being done. There's all kinds of work being done out there on the property. I think that it's incumbent upon the administration to settle this issue, to make sure that Ancestral Lands comes out with a declaration saying that if you lease this property from the military, it is not eligible as per the program for return to original landowners, or the original landowners shouldn't be the recipient of the proceeds of any lease that you'd enter into. That remains a concern, and I'm concerned that they haven't made a conscious effort to settle that issue. Yeah. I think it's really important.
Yeah, I mean, the speaker has been on and talked about it a bunch of times. I mean, we're talking about it now. Other senators have talked about it, but I don't recall hearing anything from the administration. They just seem to be skipping over that.
Yeah, here's another thing, Chris. When we talk about co-location, right? So if, for example, and I've heard a lot of people express this opinion, if, for example, we went back to the old hospital location here in Oka, right? The reason why the hospital administration continuously said, and the administration said that they prefer Manguilao is because the large footprint of land, and in order to be able to do something of the size that they want to do here at Oka, they would have to go more vertical, right? But here's what's interesting, because even in this bill, they wanted $1 million to be able to do an assessment. It got pulled out to do an assessment of the current hospital and what its future, needs assessment would be with the property. But you have behavioral health, which is actually the newest building in the government inventory, which is really in good shape. You have a footprint with that and the current hospital where they could expand on. If you built the new hospital at Oka, they would still be co-located. They'd be right down the road from each other. When we talk about public health, and I know you guys have covered this in the story, and I saw some comments from others that have worked at public health, that's a really solid building. It's got electrical problems. That's what made them have to move out to begin with, and the fire. I mean, I don't know that, the campus itself is actually a done deal and something that actually has to happen. And so, yeah, a lot more needs to be discussed going forward, aside from the fact that the legislature spoke and said, our priority is the hospital. Our priority is to make sure that $35 million of that reimbursement coming back from EIT is to build medical facilities, starting with the hospital. But yeah, you know what, Chris and Bree, you're absolutely right. There's so much more work to be done going forward. And there are people who still believe that that hospital should be built at Oka.
But they never really, I don't know, it kind of seemed like they just came out right off the bat and said, we're going to put it in McGill Eagles Field. I mean, I know there was that feasibility study, but it kind of seemed like, I don't know, common sense that you put it in Tamuning close to everything else that's, medical related. You got Jibwick right there, you got all the clinics.
Is there already water and utilities in that area?
Yeah, that's a good one, Bree, because actually that's what was discussed on the floor as well. When I made my amendment to be able to make sure that the hospital was a priority, when I talked to Gita Baum Council, they said, just try to be careful not to make it absolute, because there actually is a large requirement for infrastructure development, power. It's in the millions of dollars. Power, water, roads, all kinds of different things that need to happen. And they were actually looking at using the money up front for that. But that's not available right now. Why would you finance infrastructure, right? But they wanted to make sure that if the plan came together and the infrastructure was vital, meaning you couldn't even start building the hospital or any other medical facility, you had to put that infrastructure in. They wanted to keep that flexibility because the government might not have the money. And so that's a great question. I mean, if you already have the majority of the infrastructure here in Oka and the properties up here, that might be a consideration as well. But you're absolutely right, Bree. I think the number for power alone was upwards of $15 million. Water, of course, I didn't hear a price tag on that, but certainly we already know with Ladera and the other issues within that area, I mean, that caused the problem back in the day, right? So certainly major water upgrades would be required. So yeah, a lot of that stuff has to be worked out. What's interesting is, if you don't mind me segueing, it was just the opposite with Department of Corrections. We also passed that bill unanimously for the $5 million, for their financing mechanism. And they, came to us with a 168-page, plan in terms of their master plan that actually goes out 100 years. I mean, it's just really the detail, Chris and Bree. I mean, everything down to the phases and how this is going to be done. I was surprised they didn't bring us swatches so that we can, choose what color of paint is going to go on the outside and maybe, what the kitchen's going to look like. But it's really a great plan. And then once again, working with them, right? They knew as they were developing this master plan over the years that the property issue was going to be a problem. There's always going to be that NIMBY problem issue, right? So they are doing this entire plan on their current footprint. The major infrastructure of the building will be offset to really, we've all been to corrections and as the campus looks right now, it would be completely opposite. It'll be almost to the exact back property of the property where it's going to be built. It's vertical. It's completely sealed. It's a facility that will be almost unless somebody, a staff or for some reason a person got by security bringing in contraband, it almost is a facility that could literally almost be contraband free. The upfront cost on that one is the expensive part. 106 million for the first 3 phases, and the reason why is that contains all of their administrative stuff, their administrative offices, the Sally port to be able to bring their vehicles in, all of the kitchen facilities, culinary facilities, all of their rehabilitation aspects that they're trying to do with trades training and all kinds of things that they're going to do in those buildings in the first 3 phases. And that also brings them up to, I believe, almost 700 inmate capacity. The other 2 phases are basically far out. They don't need to be done up front. And what they're hoping is that because they're hoping to have so much success when they build the first 3 phases, they don't need to do the other phases, that there'll be more rehabilitation, less recidivism, and they're hoping to just be able to live within that. So that first 106 million, the 5 million should be easy to cover the debt service of that 30-year financing. So like I said, Department of Corrections, hats off to them. It's an excellent plan, and it's an excellent master plan, and it really should be a blueprint of how the government should do business, really.
Yeah, speaking of the Department of Corrections, one of our reporters actually took a tour
Wow.
of that facility. And, I haven't been to DOC in a long time since, I spent some time. No, I'm joking. In a while.
Since you did a bid?
And I was really shocked. I didn't know it was that bad.
Yeah. I mean, I did a tour. I did a tour there, I think, 1997 when I was here. And then we did another one, I think, when Director Director Frank Ishizaki, right? And I'll tell you, the video we shot with that tour with Director Frank, and the video that Ty shot on her tour, which was last week. Wow, I mean, the rotting of that facility it's moving pretty fast. It's moving pretty fast.
Yeah, we another thing about this project, right? I've very rarely, I don't think ever, has any agency come before the legislature and actually laid out a plan that almost pays for itself. They talked about the $3 million in overtime should basically be almost eliminated because of the manpower requirements, up to 40% less need for manpower requirements. And that's just really, like you said, it's because of the completely antiquated and outdated layout that they have currently, right? The other issue is it's really, really, really a safety hazard for the staff and everybody that goes to work there every day. And, as much as it's hard to get excited about building a prison, and we all know that, people are doing time for a reason, but they also have rights, right? I mean, the government is liable. We saw that when we had to put the locking system in place when we were in violation, different things. And so just across the board, one of the questions we asked in terms of, what are your maintenance costs currently, as looking at that as part of the savings, right, towards the debt service? And they just had to be brutally honest, saying our maintenance is day to day. I mean, we don't have a real budget for maintenance. What we do is, if we need something, we cut a purchase order and we fix something. I mean, the deferred maintenance is in the millions. So, man, guys, this, like I said, it's hard to get excited about building a prison, but it's something that's so needed. Yeah. And as you said, that facility is just, it's hanging on by the fingernails, really.
Yeah. And just to go back to the plans for a new hospital, because we do have someone commenting here and asking, Nadine Castro is asking, what happens to the football field that FD is currently utilizing to practice on? Is that also part of the property that the governor's looking at?
Yeah, I think all these things are, part of the equation, right? And then that's why it's really important, if we're gonna do this, well, we're gonna do this, but where we're gonna do it is the question, right? But I mean, I think, once again, going back to it, it's incumbent upon the administration to address this issue head on. And so if Gita's representation was correct, that there will be an offer by the federal government this month for the lease of that property. Hopefully, Chris and Bree, what that kicks off is a real conversation about, are we really going to do it there? And bring on Ancestral Lands Commission to be able to opine and to make a decision, because, you know, not only the fact that, great question, I mean, are we going to take away current recreational facilities? Are we going to take away other plans or thoughts for that property? But, you know, the issue also comes down to, are we going to get mired in a lawsuit, right?
Yeah.
Because certainly original landowners, I mean, they're not just going to lay down. You know, they're going to say, wait a minute, you're entering into a lease agreement with the federal government. Any transfers, you know, we saw that in Retidian, any transfers of property or property transactions with the federal government should always include the Ancestral Lands Commission and original landowners, right? So, yeah, I mean, to just kind of dodge that question and ignore it, I think is not the way to go about this.
And I'm just going to read the notes, right, from, there was an oversight hearing with Guam Ancestral Lands Commission several months ago. I want to say it was in April. And so one of the notes came out from the Speaker's office, because she chairs the Committee on Land, and it stated that it is unclear if the government of Guam will bypass the Ancestral Lands Commission and keep returned properties for local government projects such as Eagles Field in Manilao for a new hospital. The Guam Ancestral Lands Law was enacted in 1999 and has mandated that all property transferred to Guam by the federal government be returned by the Commission to original landowners. If it is kept by the government of Guam, then those landowners whose property was not returned would be compensated. Several Eagles Field landowners testified that the property should be returned to the original landowners. Some ALC commissioners and landowners testified that any returned land should be immediately given back to the original landowners rather than be held by the government. If the local government wants to use the land for other purposes, they should negotiate with the original landowners and compensate them justly. So, yeah, I guess you're right. You know, it would be interesting to see how this all plays out going forward. I mean, I think we can all agree that we do need a new hospital.
Yeah.
So,
But I think the problem is that we were just this kind of just
Where?
like, boom, we're going to build a new hospital. Boom, it's going to be in Manilao.
Mhm.
Boom, there's a fault line at Oka. So, yeah, I mean, it was, and I felt like we kind of slowed it down a little bit with this bill to really kind of examine, because there's a lot of questions right before this whole process. You good?
Definitely, and you know, that's why in my closing comments on this bill, I was just proud of the legislature for saying that we're going to recognize our priorities. Our priorities are public safety, our priorities are public health. And that's what these two bills did. They ended up becoming a financing mechanism, and you know, we can see now that the prison, I tell you, if they could go out and do their you know, their RFP tomorrow, I mean, we would probably be, you know, turning dirt early in the first of the year, right? But the hospital is so far off. But I was proud of our team for saying, you know what, we're going to make sure that this once in a lifetime reimbursement of this money is set aside for a key responsibility to our people, and that is adequate and proper healthcare facilities. And so, but yeah, you can see that there's just really so much else going on, Chris and Bree, in terms of this. And I hope the administration will just come forward and settle this issue straight away, so that we don't get mired in this issue. I mean, just what you just read, Bree, I mean, does that sound like a lawsuit or what, right? I mean, there's plenty of lawyers, I think, that would easily research who these original landowners are and just say, sorry, Gov Guam, you know, you need to work with these folks. And so that seems to me like it would push this project, you know, even further down the road if we don't settle this issue.
right. So what else? I noticed on the calendar today, there's like several bills going up for public hearings today, right?
Right. And here's where I also, I did work with the chairman on finance yesterday, and here's where, you know, some of the confusion. I saw some representation from BBMR a few weeks back saying that, hold on, legislature, you're over appropriating EITC reimbursement, right? So as I discussed with Office of Finance and Budget, Steve Guerrero, and also our chairman, Joe San Agustin, this might get a little confusing, but I'll try to make it as simple as possible. The calendar year 2020, is, as far as tax refunds were concerned, is appropriated in fiscal year 2021 to be able to settle the tax returns for fiscal year 2020. So right now, these bills actually, the reason why they have a funding source, and also these bills are a one-time, they're a one-shot deal. They're not financing over 30 years or 40 years like the hospital and the prison. They're a one-time appropriation. And so that's taking into consideration that the 55 million or more to come back to the government of Guam will be coming back as soon as revenue tax and the federal government reconcile how that first remittance is going to be done. So as far as we're concerned, we're appropriating that money now because that's a reimbursement to the government of Guam. Now, if the federal government comes back for fiscal year or calendar year 2021, which we appropriate in fiscal year 2022, if the federal government comes back and says, we're going to treat this like the ACTC, and we're going to give a one-time, we're going to deposit into the government of Guam's coffers as a one-shot deal. We're going to estimate 55 million, and if it's more, we'll reconcile it later. Then the governor has full control over those funds. We can't do anything with it. But for the meantime, because the calendar year 2020 that's going to be reimbursed in 2021, that's subject to appropriation because it's a reimbursement, meaning that we've already spent that money. And so since the general fund already spent it and it's going to be reimbursed, it's subject to appropriation. So you're right, Bree. There are a number of bills today. I believe the University of Guam might be one of them for their building to continue to support the development of engineering opportunities under STEM. And there are others. I believe the Department of Parks and Rec, there's a bill there for a one-time appropriation for construction of some of their capital infrastructure. So once again, the legislature continues to step up, and I'm proud of our group to say we're going to take these resources and invest them in capital improvements. And I think that that's the right thing to do. So yeah, just to be clear, once again, there was an attempt to kind of make it seem like it was confusing, like we're over appropriating. We're not, because we're appropriating a funding source that is going to be reimbursed. And the set aside that we put forward for fiscal year 2022 is money that's still uncertain in terms of how it's going to be reimbursed to the government of Guam.
What about ARP? I know have you guys heard anything at all about the plan yet, or?
We haven't heard anything about the plan, but I'll tell you what, starting with Senator Frank Blas and a lot of us now, notwithstanding our frustration, a lot of us are starting to realize that, this grand plan of the $300 million for the hospital, I think is something that should be put on hold. I think that we know that we're probably going to need that money to help our people. We're probably going to need to maybe even subsidize some of the utilities going forward a little bit more with the cost of living and everything that's happening to our folks. We know that we should invest more in employment opportunities. I'm disappointed that the program for subsidized employment has been withdrawn and pulled back. We know that there's
Senator,
so much in our
can I
community
just that was a great program. They were going to subsidize hiring of like thousands of workers into the private sector, right? But the administration said the reason why they didn't do that is because the business community, I don't know which ones, said that they'd rather just get the money to use it where they see fit.
I can understand where businesses want to basically be, receive the subsidy and do what they're doing. So if that's the case, Chris, it's still something whereby we have to prepare for it, right? We have to announce these things. We got to communicate, right? And so I supported the resolution by Senator Frank Blas and other senators to make sure that we can possibly set aside 60 to 75 million for all of our tourism industry partners who are currently dying on the vine because they're shuttered operations. So you're right. I mean, if they got that subsidy, they may continue to employ who they're employing and bring on more people. But let's talk about it, right? As long as we're saying we're going to take 300 million of the 550 or 600 million and take that off the table. And then also we have publicly committed to over $100 and some million in projects with GBB, other subsidies. We're not communicating. There is no plan then.
Yeah.
And so I think the biggest thing is we need a declaration whether or not that 300 million is on the table or off the table. Because if it's off the table, Chris, and Bree, I'm gonna tell you, there's not going to be a lot left over to continue to sustain our community. And I think that the people of Guam, now that they know that there's a financing mechanism for the hospital and for all the medical facilities, I think the people of Guam will see fit that, you know what, that 300 million should be, used to help our people. And that a hospital is probably not even going to break ground for years. And the legislature set aside money for it. That 300 million should go to help our people. We're going to need that bridge financing for the next couple of years to make sure we can help our community, because tourism is not coming back anytime soon.
Yeah.
So no plan, and that's not the way to communicate with the people. We should have a plan, and we should have it yesterday.
I just feel like, I don't know why this administration turned it into a either or kind of thing. Yeah, if the businesses need money and they need, because I'm hearing that they're using it for upgrades or, repairs or whatever, and there's no guarantee they're going to use it to hire people, which I thought that was a great program, the subsidy hiring. I don't know why they turned it into one or the other when clearly both would probably be a good idea.
You're exactly right, Chris. I mean, the people having jobs is a big deal.
Kind of a big deal. It's a little bit of a big deal, yeah.
Yeah, capital improvements. I mean, yeah. I mean, you want to fix the bathroom, you want to paint the building, yeah. But you've got to, people got to have jobs, and we've got to think about that. And that's what a rescue plan, in my opinion, is for, to rescue people.
Thank you, Senator.
Hey, thanks, Chris and Bree. Have a great day.
You too. There you go, Senator Chris Duenas with the Minority Report. It is 8 o'clock. This is The Link, brought to you by Pacific Points, Cabo Enterprises, IT&E, and Jack in the Box.